Well, 14 days is the incubation period for an infected person to show symptoms. And experts say despite Singapore's success, it's not time to get complacent. In fact, they warn that the pandemic is not over. The last 10 months have been quite the ride, as seen in this graph. Now, cases started to rise in February before peaking in May, but numbers began coming down again in June. There were only 7 locally transmitted cases this month, with the last ones reported exactly 2 weeks ago. Now let's recap some of these milestones. 4th of February saw Singapore's first local cases at a Chinese medical hall. 3 days later, the DORSCON level was raised from yellow to orange. Now, as more clusters formed in March, safe distancing measures were ramped up. All entertainment venues were closed and religious gatherings cancelled. Up to that point, local transmissions were mostly in the community. On 30th of March, the first dorm cluster was announced at S11 dormitory. And then that was followed by the circuit breaker, which kicked in on 7th of April. Mask wearing was made mandatory a week later. That month also saw the highest daily record of 1,425 local infections. 98% of them came from the dorms. A day later, all dorm residents were told to stop work. June saw the circuit breaker lifted as Singapore reopened. Strict measures and testing continued in the dorms. By end July, 262,000 workers were cleared of COVID-19 infection. 5th of August saw a spike of 902 cases amid testing of the final batch of dorm workers. And then 2 weeks later, all dorms were cleared. 13th of October marked Singapore's first day of 0 local transmissions in 8 months. Thereafter, daily numbers hovered between 0 and single digits. Since 11th of November, there have been no local transmissions. And for more on Singapore's COVID-19 situation, we have Professor Teo Yik Ying and Associate Professor Su Li-Yang, both of the NUS Saw Swee Hock School of Public Health. So perhaps we could start with you first, Prof. Su. Can you just put into perspective what this 2-week milestone means exactly, in reference to the 14-day incubation period of the virus that we talked about?
Thank you. I think it is a good milestone, and it gives us cautious optimism that our current measures, even in phase 2, are sufficient to reduce the transmissibility of the virus significantly to the point where probably the majority of small outbreaks might burn themselves out. But I stress the word cautious here because countries such as China and New Zealand have also reached the same stage and beyond in the past, only to have to deal with fairly large outbreaks of COVID-19 that reappeared in their populations.
Professor Teo, bring you into the conversation next. And, we saw today Singapore reporting 18 imported cases. That is the highest in quite a while, 2 weeks to be exact. Is that a big concern to you, especially since the countries continue to reopen their borders?
Well, it is a concern from the perspective that the pandemic continues to rage on outside Singapore. And we see this played out very clearly in how some of these travelers are coming into Singapore. They are testing positive, despite the fact that some of these travelers would actually have been tested negative prior to departing for Singapore. But I think if we look at it, the risk of these imported cases spilling over to the community and starting new clusters in the community in Singapore, the risk is actually very low, given that Singapore maintains a series of very well-calibrated border control measures, calibrated actually according to the risk of importations, depending on where these people, the travelers, are coming from. And we are picking up these imported cases while they are in stay-home notice, quarantine, before they're allowed to mingle with the general community. So the risk is actually very low.
Professor Su, there have been a lot of talk about these vaccines. A number of them are front runners in the trials. Will having a vaccine actually change the measures that, Singapore have, implemented just to try to keep the infection rates low? At the same time, we're also trying to revive our tourism economy.
I think vaccines, because there's likely to be more than one if taken up widely, will add another effective layer of protection to our measures, such as better hygiene and face masks. I think it will be foolish to drop all our current preventive measures and revert to the pre-pandemic way of living straight away, because vaccines are not a miracle that will cause COVID-19 to become a bad memory. So even if the vaccines were 95% effective, which a couple of them are at this point, and say we vaccinate 80% of the population, that still leaves about 25% vulnerable to infection. And herd immunity doesn't mean that no one will get COVID-19, but just like with vaccines to other infectious diseases, it means that we won't have big clusters of cases that continue to transmit exponentially. But we were talking about the tourism economy, right? And travel and tourism will definitely pick up again. And I think some of the safe distancing restrictions will be relaxed as we go along.
Okay, Prof. Teo, it seems that when talking about vaccines, every country or Big Pharma wants to claim that, they are in the lead, they are the front runners at this point with high percentages of effectiveness in late-stage trials. I'm wondering, could you put all this into perspective for us in terms of who is really close to the finishing line? And does it matter? Will we as citizens get a choice at the end of the day?
Well, I think, firstly, it's asking the question whether the countries will be able to receive the sufficient supply of vaccine to vaccinate a substantial number in the country within a short span of time. And I think the reality is that given the need to vaccinate quite a number of people around the whole world, the likelihood for the average people to get hold of a vaccine within the next 3 or 4 months, I think the likelihood is going to be very low. Even with the COVAX facility that the World Health Organization is talking about, they are only guaranteeing 20% of the population, supply of vaccine to vaccinate 20% of the populations. So I think it's quite clear we will actually need to wait a while before there are sufficient doses to vaccinate the population to the level that Professor Su talked about, achieving some degree of herd immunity for us to start thinking about lifting some of the measures, be it border control measures, or some of the safe management measures we have in the community.
Also, Professor Su, we haven't really talked about children in all of this. Vaccine makers, are they also working on inoculations for children, or it wouldn't make much of a difference?
I think it would be the same vaccines rather than different vaccines. The children's trials have not started yet. That's because COVID-19 is a bit unusual in the sense that children are affected less than adults. I'm sure that's coming along.
And just to get the take, perhaps from the two of you very, very quickly, what is your anticipation of when we enter phase 3 based on the development of vaccines and how we're controlling the situation of incoming cases? When can we expect the reopening by the end of the year?
Either one of you can jump in. Go ahead.
Phase 3.
The multi-ministry task force has actually stated quite explicitly some of the conditions, the 3 conditions that Singapore needs to achieve before we can start to move into phase 3. The use of the widespread adoption of Trace Together, having greater community adoption of some of the, and compliance, cooperation to the measures. So once we achieve that, I think that's where we are a step closer to phase 3. And we can see in terms of testing capability, Singapore is there. In terms of cooperation and compliance, I would say that the population has been fantastic in working together with the authorities, with the employers, to make sure that they keep to the rules. And right now, it's really making sure we continue to play our part to use Trace Together, the Safe Entry app, to make sure that our movements are recorded for the purpose of contact tracing. And this way, with the cooperation of the people, I think that's where we will look forward to moving towards phase 3 as early as possible.
All right, Prof. Su, briefly, if you have anything to add.
Sure. It's also clear that phase 3 is not the old normal. It just means more of the restrictions will be removed. And the task force has also mentioned that phase 3 will last for more than a year. So I think it will last beyond the vaccine being commercially available until such time as we can assess what's happening in the rest of the world.
All right. Well, we didn't quite get a specific date, but close enough, gentlemen. Thank you so much for giving us your thoughts on that. We've been speaking with Professor Teo Yik Ying and Associate Professor Su Li Yang from the NUS Saw Swee Hock School of Public Health.